One of the hardest parts of becoming a massage therapist is discovering that the treatment room is not a classroom. During training, you learn anatomy, techniques, positioning, and the basic structure of a session. You practice on classmates who understand that you are learning. Then, suddenly, a real person lies down in front of you and expects you to help. They may arrive with pain, stress, fear, a long medical history, or a very specific idea of what massage is supposed to feel like. Sometimes they will ask you a question you have never been asked before. Sometimes they will expect an immediate answer. And sometimes, even after you do everything carefully, the result will not be as clear as you hoped. That transition can be uncomfortable, but it is also where the real profession begins. If you are new to massage therapy or bodywork, here are some of the things people often do not explain clearly enough at the start. The first is that technique is only one part of the job. It is easy to believe that becoming better means collecting more techniques. You learn a new stretch, a new release method, a new way to work on the neck, the shoulder, or the lower back. More knowledge is useful, but technique alone does not tell you what this particular person needs today. Two people can describe the same pain and need completely different approaches. One person may need movement and a lighter touch. Another may tolerate or even prefer more focused pressure. One person may be looking for temporary relaxation. Another may be trying to return to work, sport, sleep, or daily movement. The important question is not only, what technique do I know? It is also, what is the goal of this session and how is this person responding while we work? That requires observation, communication, and the willingness to change direction. A treatment is not a performance where you prove how much you know. It is a conversation between your hands, the client's nervous system, and the information the client gives you. The second difficult lesson is that clients do not always know how to describe what they need. Someone may say, "My back is tight," but that sentence can mean many things. They may be sitting for 10 hours a day. They may be anxious, tired, deconditioned, recovering from an injury, or simply not used to noticing sensations in their body. Another person may say, "I want the deepest massage possible," but what they really want is to feel understood. Or they may have had a previous treatment where pain was treated as proof that something important happened. This is where the intake conversation matters. You do not need to interrogate someone, and you do not need to sound like a doctor, but you do need to ask enough questions to understand the situation. What brought them in? What makes it worse? What they hope will change? And whether anything needs medical attention before treatment. The more clearly you understand the goal, the less you have to rely on guesswork. You will also learn that pressure is not a simple measure of effectiveness. New therapists can feel pressure from both sides. Some clients ask for more because they think deeper must be better. At the same time, the therapist may feel that a session is not impressive unless the work looks intense. But the strongest treatment is not always the most aggressive one. Too much pressure can make a person guard, hold their breath, become more sensitive, or feel worse afterward. Sometimes deeper work is appropriate. Sometimes a smaller, more precise input is more useful. The skill is not maximum force. The skill is choosing the right dose for the person, the tissue, the goal, and the response. That is a difficult idea to trust when you are new, because dramatic work can look more convincing than quiet work. Over time, you start to notice that a good session may be the one where the client moves more easily, breathes more freely, understands their body better, or leaves feeling safe enough to continue improving. Another part of the beginning that surprises many therapists is the business side. Training often prepares you to treat people. It may not prepare you to explain your prices, handle cancellations, fill empty hours, write a clear message to a new client, or decide how much work your own body can tolerate in a day. You may feel uncomfortable charging for your time, especially when you are still building confidence. You may compare yourself with therapists who have been working for years. You may accept every request because you are afraid that saying no will make the client disappear. That can lead to undercharging, overbooking, and resentment. Clear policies are not a sign that you are cold or difficult. They are part of creating a stable professional relationship. Decide what a session includes, how long it lasts, what happens when someone cancels, and what kind of communication you can realistically provide. You do not need to copy another therapist's business model, but you do need a structure that allows you to keep working without constantly feeling insecure. The same is true for boundaries inside the treatment room. Clients are often vulnerable. They may talk about their health, their relationships, their fear, or a difficult period in their life. A therapist can be warm and attentive without becoming responsible for solving everything. You are there to provide a professional service, not to become the client's only source of support. You can listen without promising more than you can offer. You can be compassionate while keeping the session focused, and you can say no when a request is unsafe, inappropriate, or outside your training. This becomes easier when you remember that boundaries protect both people. They make the relationship clearer, and clarity is part of safety. Then, there is the physical reality of the work. Many new therapists begin with enthusiasm. They want more practice, more clients, and more experience. They may work with their hands for hours, repeat the same position, lean too far over the table, or use effort that should be coming from their whole body. At first, the body may tolerate it. Then, the wrist, thumb, shoulder, neck, or lower back start sending a message. Your body is not separate from your career. It is one of the tools that makes the career possible. Learning to adjust table height, use your stance, shift your weight, change positions, take breaks, and vary the type of work is not a luxury. It is professional maintenance. You also have to notice the difference between useful effort and unnecessary strain. A treatment should not depend on you fighting the table with your joints. If every session leaves you damaged, the problem is not that you need to become tougher. The way you are working may need to change. The emotional side can be just as demanding. Some sessions will go beautifully. The client will feel a difference. You will understand what happened, and you will leave with the satisfying feeling that the work mattered. Other sessions will be confusing. The client may not improve immediately. They may give very little feedback. You may question your choices afterward and replay the whole treatment in your mind. That uncertainty is normal. A single session does not always give you a simple verdict on whether you are a good therapist. Bodies change for many reasons, and pain does not always follow a straight line. What you can do is stay curious, ask better questions, keep notes when appropriate, notice what changed, what did not change, and what the client says in their own words. Discuss cases with experienced professionals when you can, while respecting privacy. Over time, these small observations become clinical judgment. You do not need to know everything before you begin, but you do need to know how to keep learning without pretending to know what you do not know. You will also discover that confidence does not arrive all at once. At the beginning, confidence may mean simply staying calm during an awkward moment. It may mean telling a client that you need more information. It may mean changing your approach halfway through a session. It may mean recommending another professional when the situation is outside your scope. That is real confidence. It is not acting certain all the time. It is being able to work carefully, even when you are still developing. The first years are not only about becoming better with your hands, they are about learning how to see the whole situation, the person, the goal, the context, the risks, the response, and your own limits. If you are new, try not to measure yourself only by how impressive your techniques look. Measure yourself by whether you listen well, explain clearly, respect boundaries, protect your body, and give each client an honest and thoughtful session. You will make mistakes. Every therapist does. The goal is not to avoid every mistake. The goal is to notice them, learn from them, and avoid turning one difficult session into a judgment about your entire future. Eventually, the work becomes less about proving that you are a therapist and more about practicing the profession with steadiness. You begin to understand that helping someone does not always mean eliminating every symptom. Sometimes it means reducing fear, improving movement, giving the person a better understanding of what they are feeling, or helping them take the next useful step. That may not look dramatic from the outside, but it is meaningful work. So if you are starting out and the job feels harder than you expected, that does not automatically mean you chose the wrong profession. It may mean you are discovering the parts of the profession that no training room can fully simulate. Keep learning, stay within your scope, protect your own body, communicate clearly, and remember that a good therapist is not the person who always appears certain. A good therapist is someone who keeps paying attention,